my lecture is we need to diagnose holistically. We need to be in touch with the patient's airway system. We need to be in touch with the why behind the malocclusion. Why are they wearing out their teeth? Why do they have an open bite? Why do they have a cross bite? Why do they have a high arch? We have to understand the why. We have to look for the why. Hi, I'm Dr. Tito Norris from San Antonio, Texas, and I'm an orthodontist. I've been an orthodontist for 30 years now.
What do you think about the dental world? Do you enjoy the event and its atmosphere?
Well, this is an impressive Congress. I've come all the way from the United States, and I was actually very impressed to see all the vendors, all the speakers. It's quite an impressive meeting.
How does the Norris system optimize bracket positioning to achieve earlier and more efficient wire engagement?
Well, the key to the Norris system is the fact that we have a smaller slot size. So it's an 020 by 026. So traditional brackets are 022 by 028. And so with the smaller slot size, we can actually engage the wire very intimately to get better three-dimensional control during finishing. And this results in fewer appointments and faster finishing because it's much more efficient when we don't have the slot, if you will, between the wire and the bracket.
Could you elaborate on the 7 factors affecting size discrepancies and their impact on achieving predictable occlusions?
Sure. Well, anterior tooth size discrepancies are one of the things that present orthodontists with a challenge in terms of finishing the case. And so those 7 factors are small maxillary lateral incisors, wide mandibular incisors, reduced torque of the maxillary incisors, excessively torqued mandibular incisors, deep bite, thick marginal ridges of the maxillary incisors, and cuspids that are not coupled with each other. So we have to consider all of these factors and how we're going to change these factors in order to give us an ideal fit of the anterior occlusion. And if we do that, then generally speaking, the posterior occlusion will fit well together. But the anterior is definitely more challenging, and we have to consider the 7 factors.
And how does the Norris system incorporate facial aesthetics and aging consideration into treatment planning?
Well, the Norris system is essentially a bracket system, but it goes well beyond that because we have to look at patients from a macro aesthetic perspective, facial characteristics, from a mini aesthetic perspective, smiling characteristics, and from a micro aesthetic perspective, these are dental characteristics. And when we look at all of these factors together and we do basically create a smile with the central incisors as the dominant point of that smile, then we can create a beautiful smile that has the elements of smile projection, gradient, and a consonant smile arc, which is what we're looking for in all of our beautiful finishes.
What is the take-home message of your lecture?
The take-home message of my lecture is we need to diagnose holistically. We need to be in touch with the patient's airway system. We need to be in touch with the why behind the malocclusion. Why are they wearing out their teeth? Why do they have an open bite? Why do they have a cross bite? Why do they have a high arch? We have to understand the why. We have to look for the why. And if we can understand that, then we can more effectively diagnose the patient and treat the patient. And we have a lot of tools available to us to help give us an optimal result. And we should all be utilizing those tools, whether it's orthodontic surgery or periodontics or restorative dentistry, implants, TADs, many different things. We combine all of that with an appliance system that's very efficient and works very effectively, and we can get beautiful results. Well, I've thoroughly enjoyed our time here in Budapest, and it's been a spectacular event. It's still very early in the conference, but I'm looking forward to all the amazing speakers that have lined up and this fantastic exhibit hall of vendors from all over the world. It's really a world-class event, and I'd recommend you come check it out next year.